Hi, and welcome to Tapped into Hudson. I'm Steve Lenox. I'm the publisher of Tap into Bayonne, Tap into Hoboken, and Tap into Jersey City. As we get started with this show today, I'm reminded that we're heading into Christmas season, and we want to make sure that all of our readers have a bright and festive Christmas. And with that, over the next couple of weeks, we're going to share as much information as we can about toy drives and other efforts to make sure that our children in the community are looked after. So as you look up on the screen, you'll see a flyer for the Captain Mark V. Lee Toy Drive. It's an annual event in honor of Fire Department Captain Mark Lee, who unfortunately passed away in 2014. But his family has continued this great legacy of giving, and we're very happy to support that. Also, on a bit of a somber note, we want to send our condolences to the family of Sergeant Peter Zanin, Hoboken Police Department Sergeant, who unfortunately passed away on November 21st. He was a proud member of the Hoboken Police Department, beloved member of the community there. He'll be missed, and we wish his family the very best and extend our prayers and condolences. With that, we're going to turn to our first guest today, our only guest today, and that's Debbie White, president of the HPAE, the nurses union here in New Jersey. Debbie, how are you today?
I'm well, thank you.
Debbie, thank you so much for joining us. Before I get into the question and answer here, I've learned over the last couple weeks how quickly these shows go by. And every single week, the 24 minutes goes by, and I realize I forgot to ask a question, or I forgot to say something that I meant to say. So at the very outset, I want to say thank you. And that's to you, to all of your members, and to all of the healthcare professionals across New Jersey and across the country that are doing so much to bring us through this devastating time that we've gone through since March. So Debbie, with that, you represent 2,000 members here in Hudson County, about 1,000 of whom are in Bayonne and Jersey City. And these are nurses, but these are also other healthcare professionals. These are respiratory therapists. These are our catering staff potentially. Tell us about the union and who you represent.
So we are the largest healthcare union in New Jersey. We represent about 14,000 members statewide. About 2/3 are nurses, and the other third are healthcare professionals like respiratory therapists, nursing assistants, unit secretaries, food service, transport workers, environmental services. In fact, from this COVID pandemic, our first member to pass away was a transport worker.
Debbie, let's talk about that for a minute. You've lost members since March. How many?
We've lost 6 members that we know of. But again, well, maybe not again. I haven't said it yet on this particular show. But we don't have anyone mandating employers to keep track of those numbers. So we really aren't sure how many of our members are actually sickened and the exact number of those who have actually passed from COVID.
Debbie, that's something I want to get into in a few minutes. But before we do that, let's go back to March when COVID first started hitting our communities. It got worse and worse and worse. What were those first 4 to 6 weeks of COVID like for your members?
They were absolutely horrifying. Most of our members don't ever recall a time in history where they saw tents being set up outside their hospitals, where they saw refrigerator trucks pulling up to contain the record numbers of deaths from this pandemic. They don't remember patient loads being as heavy. They don't ever remember being put in situations where they are the sole support for these anxious, terrified patients suffering from this awful disease. So it was awful. It was horrifying.
Debbie, I think horrifying is a great word. As we went through this, loss is a part of being a nurse, obviously. This is something that's, I guess, becomes ingrained in you almost, unfortunately. But this was unprecedented, horrifying, as you say. What other support was there for the nurses and the other staff to sort of help deal with this, to process this great loss?
I'm not really sure there was a lot of support for nurses, to be honest with you. We were so overwhelmed so quickly that it was a matter of just dealing what was in front of you on a day-to-day basis, on a minute-to-minute basis for our nurses and other healthcare professionals. Our members lived through hell. I mean, I know these suffering, dying patients were put in a terrible situation, but our healthcare professionals, they lived through the hell as well. There was a lot of suffering, there was a lot of death, and seeing the same things that we saw in March, April, and May starting to happen all over again is bringing up a lot of symptoms in our members of PTSD. The terror, the absolute fear, and feeling traumatized and anxious all of the time. It's actually what I hear in a lot of our leaders, because I am trying to start weekly calls with our leaders of every hospital that we have in the state, just to be able to check in with them and see how they're doing.
And that's so important. You know, we hear a lot from first responders and other frontline workers, this idea that they have their family at home, but then they also have the family at the workplace, which is providing some comfort, some love, some warmth. Has that happened in the hospitals with the nurses? Have your staff been able to come together as brothers and sisters in solidarity, so to speak?
Yes, in a lot of ways, it's like being on the front line of a war. You know, you go through these things, you're just trying to live second to second, but you're relying on your coworkers to keep, to support one another and be there for one another. When you leave, though, the fear is very real in our members that they're going to now bring this virus home to their family. So it is imperative that we protect our front lines, that our employers protect their workers.
Debbie, I want to talk a little more about protecting the workers as we get into the next segment. But in the last 45 seconds here, what do we think the long-term impact is of this energy that's been expended, not on patients, but on taking care of themselves, the mental toll that your members have gone through?
I mean, if we look at PTSD in the average, war veteran and other traumatizing situations that we've seen, those effects start to show up later. They start to show up when the person is put in the same circumstance that caused these symptoms to develop in the first place. I'm not sure exactly what we're going to be seeing, but we can sort of look at those other experiences that like situations have created and kind of anticipate the same symptoms that they've gone through with PTSD to hit our members as well.
Debbie, when we come back in a minute, we're going to talk more about this second wave, and I want you to talk to our readers and our viewers about what we can do to try to knock it back a little bit. With that, thank you.
Thank you.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants, all major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Good Friend Self Storage in Northburg, New Jersey is a fully climate-controlled facility equipped with state-of-the-art security, packing supplies, a Refer Friend program, and multiple loading docks convenient for commercial use. Located just off of Route 3 at 4301 Tunnelly Avenue, Route 1 and 9. Call 201-867-2444 or visit us on the web today. Good Friend Self Storage. Let us be your good friend. Pen & Pinto Properties, Jersey City. Shaping the workplace with state-of-the-art office spaces that address your company desires. Building residences that define your home environment, adjacent to all modes of transportation with on-site parking available. The right address, the right lease. Call 201-521-9000 or visit online at penandpintoproperties.com. Pen & Pinto Properties, building Jersey City for everyone.
If you need to see a doctor, RWJ Barnabas Health has 2 easy ways to do it from anywhere. You can see an urgent care provider 24/7 on any device with our telemed app. Or use our website to book a virtual visit with an RWJ Barnabas Health Medical Group provider or specialist, even as a new patient. You've taken every precaution, and so have we, so don't delay your care any longer. RWJ Barnabas Health. Let's be healthy together.
Hi, and welcome back to Tapped into Hudson. I'm Steve Lenox. I'm the publisher of Tap into Hoboken, Tap into Bayonne, and Tap into Jersey City. I'm joined today by Debbie White, president of the HPAEE. Debbie, thank you again for joining us, and I'm going to take a second chance today. Thank you to all of your members across New Jersey that are doing so much in this battle. Debbie, we spent the first part of the show talking about the first wave of COVID. We had a bit of a reprieve over the summer. The numbers dropped down, thankfully, but now we are very much into the second wave. How are your members coping now as numbers increase again?
Well, our members are seeing the same things come back that they saw in the first wave. The surge is beginning to overwhelm our hospitals. Many of our members who lived through the hell of the first surge are watching those same exact situations occur all over again. For instance, they're seeing the refrigerator trucks come back that were housed outside of our hospitals. They're seeing the tents back up. They're seeing that their ICUs, their ventilators are starting to fill up, and the ICUs are starting to fill up. It's just frightening.
Debbie, what is, we've been warned and warned and warned. Stay out of big crowds, wash your hands, wear your masks. And we have people out there that want to believe that this isn't real, that this isn't happening, that these numbers aren't really increasing. How can we get through to people that this is happening, that we need to do something?
Well, denial's a pretty strong thing, isn't it? It causes people to behave in ways that are contrary to what's best for them as well as others. It's always frustrating to me to walk out in public and see people who aren't masked. I just can't quite conceive of why someone would still believe that this is COVID-19 is not a real thing, that this pandemic is not really happening. I don't know what makes people behave that way, except that it's denial.
It's denial. Are we better prepared for the second wave as it continues to increase?
Well, the truth still exists that there is no federal or statewide pandemic plan. There isn't. So translated means that every hospital was given complete authority to handle the crisis in whatever way they saw fit. And some did very well, but most did not. Most of the hospitals that we saw did not. We saw some really egregious safety violations. We saw healthcare workers put at risk. We heard healthcare workers say that they felt disposable. We filed many OSHA complaints in response to this unsafe environment. And we saw OSHA cite many of our employers for safety violations. So we had hoped that the citations that came from OSHA would result in every employer developing a plan of correction. And that's the win for us. If we have a citation from OSHA, the win for us is not a penalty ascribed to the employer. It is the plan of correction that we would hope that would have improved the work environment. But the truth of the matter is that in many respects, this just hasn't happened. For
what
instance,
is it that's missed? That's what I was going to ask. For instance, Debbie.
For instance, the governor signed an executive order mandating 90-day supply of PPE be kept on hand by every employer. But if the supply is counterfeit, what then? If masks you're passing out to healthcare workers that you're representing as N95s, which are the only protection that can keep you from getting COVID-19, then what happens if they are not protecting the workers? It means your workers will get the disease or can get the disease because they're unprotected. Employers, when they receive shipments of PPE, they should be vetting every one of these shipments. They had 4 months to make sure that their PPE was genuine. But apparently, this didn't happen. It's frustrating.
Debbie, if the healthcare workers aren't protected, if the nurses aren't safe, if the other staff isn't safe, how can I be safe as a member of the public, as a potential patient? How can I be comfortable that I'm going to walk into one of these hospitals and be able to be adequately cared for?
Well, that's a really, really good question, because the answer is you can't. You know, when a worker in this state gets COVID, an essential worker, including healthcare workers, the law says they are presumed to have gotten the disease of COVID-19 in the workplace. They are automatically presumed to have workers' comp. So the assumption here is that they got it in the workplace. And what we're seeing, with what we've seen, we understand how that's happening. And it is happening. But you're correct. Patients aren't safe, workers aren't safe, families aren't safe, communities aren't safe if we're not protecting our healthcare workers.
Debbie, what is the HPA doing to stand up and let the hospitals know and let the governor know and other lawmakers know our members aren't safe, no one's safe? What's that message been? How's that been delivered?
Well, we've delivered it to the state. We've delivered it in the form of the workers' comp bills. We've delivered it to the Department of Health. We've delivered it on programs like these, and thank you for having us to be able to get this message out. And we've delivered it in print media. We've tried everything. We've done as much as we can to get this message out to the public.
Is it getting through at all?
We know that employers are becoming very uncomfortable hearing that their equipment is counterfeit. We know that is happening. We've filed complaints with the Department of Health, and they've been in to inspect. We haven't heard of outcomes yet, but we are hoping it's having an impact. Just like we hoped that we would have an impact with all the OSHA citations we received. So that kind of remains to be seen.
You're not looking for fines, you're not looking for penalties, you're looking for things to be fixed. You want things to be made right, you want your staff to be safe.
Yes, absolutely. We're looking for staff to be safe, because what's going to happen when our staff, our nurses, our frontline caregivers get exposed and sickened? Then what? Who's going to care for the patients? We have a finite number of staff now available to us. We don't have the same staff available that we had in the first wave, because the entire country is surging right now. So what happens is those members, those healthcare workers that came from agencies, that came from the military, came from traveler staff, they're probably deployed to other parts of the country already. And we don't have endless resources. I think the governor said that already. We have healthcare workers. It's been reported in the media. We don't have endless staff. And we thought we were short staff in the first surge. I think we're going to find that we're much shorter in staff in this surge than we were in the first.
Debbie, I think we'll talk about in the next segment that the nursing staff has been short-staffed well before COVID even came along, let alone a first or a second wave. With that, we're going to take a quick break, and we'll be back with Debbie White to wrap up the show.
Stevens Jersey City Ford, located right off of NJ 440 North. Across the Hudson Mall is your one stop for all your automotive needs. Check out Ford's latest models like the 2020 Ford Fusion with its stylish looks and hybrid options, or the unparalleled high-performance 2020 Ford Mustang. The 2020 Ford F-150 Raptor is ready for those rugged off-road terrains with trail control. Need a mid-sized truck for your towing and hauling? The 2020 Ford Ranger will deliver. The 2020 Ford Escape is a luxury SUV that was made for comfort and adventure on the go. Returning is Ford's legendary Bronco, which takes you back to the true meaning of off-roading. They are now available for pre-order in our showroom or on our website. Let us help you find your next vehicle. Stevens, Jersey City Ford, 201-432-7272.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net. The Jersey City Medical Center. You know it for its award-winning, life-saving ambulance service. It's also your health hub, with health and wellness locations staffed with certified professionals all through Hudson County. The Jersey City Medical Center, here to help you with your healthy, here when you need us the most. The Jersey City Medical Center. Visit us on the net to learn more. Jersey City Medical Center, Robert Wood Johnson, Barnabas Health Facility. Let's be healthy together.
Hi, and welcome back to Tapped into Hudson. I'm Steve Lenox, and I'm the publisher of Tap into Hoboken, Tap into Bayonne, and Tap into Jersey City. I'm joined today by Debbie White, president of the HPAE, Statewide Nurses Union, and we're continuing to talk about COVID-19, something that's come up in every show. Debbie, thank you again for joining us and for staying with us. You know, I'm struck that over this past weekend, Thanksgiving weekend, we saw people travel in record numbers, despite the warnings, despite the obviousness of the fact that numbers are going up. I'm sure you saw the same thing I did. What is your message to people that are thinking about now about Christmas travel, thinking about Christmas parties, thinking about how to spend their next weeks here?
Stay home. Don't gather in big crowds. Wear a mask. Socially distance. All the things that have been said over and over again. I mean, it can't be clearer, but it doesn't always happen.
And when we talk about staying home, Debbie, we had restaurant owners on a few weeks ago, and of course they actually were very supportive of some of these cuts that have taken place. But here are other restaurant owners and business owners, and we sympathize with them, right? That their livelihoods are being lost. What is your message to them?
We're in a pandemic. I mean, I don't know what else to say to that, except that we're in a pandemic and people need to take precautions. You know, when that person ends up in the hospital and has no healthcare worker to take care of them, then they'll understand, unfortunately, why it's so incredibly important to be safe.
We have to take
Can't
these
say it any
short-term
differently.
steps, right? We have to face the uncomfortability of being home. Debbie, let's talk about being home a little bit. Your staff doesn't have the luxury of being home. You know, if anything positive has come out of this for some of us, it's this incredible amount of time we've gotten to spend with our family, me certainly. But your staff, your members don't have that. They're away from their families for hours and hours and days on end. Again, how are they coping with that? How are they facing into a Christmas season with days away from their family, most likely?
Well, I mean, they're facing it in the same way the rest of the public is, except that they understand the inherent dangers. They understand the need, the tremendous need to keep safe, to stay safe. You know, our healthcare workers have, some of them have gotten pretty sick. I know a lot of them who have been sick. Regarding what those numbers are, your guess is as good as mine, because hospitals, unlike every other institution in the state, they're not mandated to keep track of this data. They're not required to keep track of the numbers who are sickened or who have died from this pandemic. We are attempting to get a bill passed that would mandate the employers to keep track of this data. And we're really hoping that it does pass in the Assembly. It's passed in the Senate, and we're waiting for it to get passed in the Assembly. We're doing a lot to get it passed in the Assembly. But this bill would mandate that employers actually report the data, track the data, and send it to the Department of Health, who will then develop within 12 months a report that would help us in the future with any other pandemics. It would result in a report within 12 months that would help us have an honest window into into healthcare, so we can better understand how to manage outbreaks in the future.
Debbie, before we got into the COVID-19 pandemic in March, the HPAE, any union really, one of their greatest functions is what they do for their members in the State House in terms of legislation. Certainly HPAE is no exception to that. And I had the pleasure of working side by side at times with your former president, Ann Toomey, who, when she walked into the State House, I think people knew it was time for business. Serious things were going to happen. What are some of the other pieces of legislation, policies that you're working on at HPAE?
So the bill I just spoke about a few minutes ago is A4129. It's what we call our data bill, and it would require employers to report sickened workers from the pandemic, from COVID-19, and also workers who've died from the pandemic. And it's just inconceivable to me why we don't have that data posted. We have other employers posting this data voluntarily, but our employers will not do so. And why? Because it may give a window into the work environment. Why? Because they don't want it known that their workers were exposed, but they were. They have been. Another one, a piece of legislation that was passed back in either August or September, was a workers' comp presumptive. And I talked about that a little bit earlier as well. And it says, this law now says that there is a presumption that coronavirus infections contracted by essential employees, including healthcare workers, are work-related for the purpose of unemployment benefits and other benefits as well. But we have been desperately trying to work on worker safety. That is our primary goal, keeping our workers safe, keeping our workers from getting COVID-19.
Again, Debbie, I think it goes back to if your workers aren't safe, if the nurses that are supposed to be taking care of us aren't safe, none of us are safe. The last question I want to ask you today, Debbie, we are getting days away, maybe weeks away from a vaccine being released. And of course, we know it's going to be many months until that gets released in a large scale way. But what is your message to the community, sort of allowing them to feel comfortable with the fact that a vaccine is going to be viable and it's going to make a difference?
We're very hopeful for a vaccine. We're very hopeful that when it's finally studied and proven to be safe, that it is going to be taken by a large percent of our communities so that we can get this pandemic under control. I've heard some really good things about it, and
Debbie,
I know that it's coming
I'm
out.
Sorry, I'm going to have to cut you off and wrap up the show. This is such a good conversation. Let's get back into the fact that 24 minutes just isn't enough. Debbie White, thank you so much for joining us. To the thousands and thousands of nurses all across New Jersey, thank you. To our viewers and our readers, please stay safe, stay healthy, stay masked up, stay apart. Do your bit to help the healthcare workers. Thank you.